You're listening to Girls with Grafts, a burn community podcast created by Phoenix Society for Burn Survivors, a leading nonprofit dedicated to supporting the burn community. In this podcast, we'll talk with burn survivors, share resources to help with supporting and improving burn recovery, and discuss how to prevent burn injuries. Here are your hosts, burn survivors and Phoenix Society's marketing team, Amber Wilcox and Rachel Kudlak.
Hello, everyone, and welcome back to Girls with Grafts. I am Rachel Kudlak. I'm one of the hosts of the show. And today, unfortunately, I will not be joined by my lovely co-host, Amber Wilcox. But I do have an amazing guest lined up for today's episode, and I'm so excited to dive into today's topic. So without further ado, let me give a quick shout out to today's podcast partner. And today's podcast is powered by Allosource. Allosource is one of the largest human tissue providers, honoring tissue donors by creating innovative skin allografts to help burn surgeons heal patients. You can learn more about Allosource and their continuing education hours by visiting their resource marketplace listing on Phoenix Society's website. So we will have that along with their website linked below for our listeners to check out. But like I said, I have a fantastic guest today. Today, we are welcoming Dr. Cliff Sheckter to the podcast. Dr. Sheckter is the Burn Center Director at Santa Clara Valley Medical Center, which serves the San Francisco Bay Area in burn and trauma care. He is double board certified in plastic and reconstructive surgery and surgical critical care, and dedicates his practice to burn patients and survivors. He completed his medical and surgical training at USC, Stanford, and the University of Washington. Dr. Sheckter is an assistant professor of surgery at Stanford University and teaches medical students and residents comprehensive burn care. He is also a health policy researcher and has published multiple articles related to burn survivor quality of life and health economics in burn care. So, Dr. Sheckter, thank you so much for joining us today.
Thank you so much for having me, Rachel. I really appreciate it.
Yeah. Well, I know I just read your bio, but we always love to kind of start off by asking our guests a little bit more about themselves, and particularly for you, I guess, tell us exactly what drew you to the burn care field and scar reconstruction in particular.
Sure. So I'm a California native, originally born and raised in the High Sierras in the Mammoth Bishop area. I did my schooling and med school time in Los Angeles. And for me, it was a very fateful moment when I was at LA County, USC, in their burn center. The students are required or asked to do an ICU rotation in their third year. And I had heard that the burn rotation was very hands-on and a very worthwhile experience. And so I rotated through that service. And over the course of weeks, I was just absolutely amazed to be drawn into a field where, in one moment you're in the ICU taking care of some of the most critically ill patients in the hospital and saving their lives. And in that same day, you're also in the clinic, evaluating a burn survivor who has a scar, and then, taking them through a process of surgery and giving them back elements of their quality of life that were temporarily lost in recovery from the burn. I was really drawn to the team. I love working on teams. I love being a part of a team. There's no bigger team in all of medicine than the burn team. It's required as part of American Burn Association verification, but it's really in the DNA of all of us, just to want to come together and value the opinions of everyone from occupational therapy, nursing, psychology, physical therapy. That team sport atmosphere was just so positive, and I felt mission driven in joining the burn community for a cause. And that was back in 2010, 2011, so going on 15 years ago, and I've never looked back.
I love that. When we tend to ask that question to a lot of the burn care professionals we have on, and I always just love hearing, that story, and it's kind of similar for most folks of like you were drawn to like the team family aspect of burn care. And as a burn survivor myself, that's like what I want to hear from, the burn care professionals is that it really does take a village, and just that team camaraderie and, the dedication that especially you in particular have to the burn survivor community is amazing.
Yeah. I mean, in so much of medicine, the workflow is, you have this problem, you see that doctor, and then it's like a one and done thing. And, you have this problem and you get that consultation, and, the human body kind of gets divided up into all these different specialists who have their little blip of time and then they disappear. And in burn, we use the word own, but, we have patient ownership, and we own the patient, from the moment of injury, really for life, especially for some of our largest burns, because working through scars is a lifelong process. So I was also just really drawn to that idea of like the lasting relationships we have with our patients, which just, is very invigorating and gives us the motivation to, keep treating the new tough cases that come in through the door.
Certainly. Well, I know, and I read this a little bit in your bio, some of the work you're doing aside from just helping your patients and survivors. And you recently, we got to connect last year because you built this decision aid for reconstructive surgery. We did a little blurb in it in the magazine, so we will have that article linked below for folks who want to, read a little bit more about it. But can you just kind of tell our listeners a little bit of, back from the beginning, like how did this work even get started to build this decision aid, and what drove you to this project?
Sure. Yeah. And I just am so grateful to the Phoenix Society for being a partner in this project, particularly Jill Sproul and Amy Acton for their interest in this work that has been funded by the Plastic Surgery Foundation largely. So about 10, 15 years ago, there was a revolution in plastic surgery, reconstructive surgery, focusing on patient-reported outcomes following surgery. I mean, it seems like a pretty obvious thing to most people, but if you're going to operate on someone, particularly around scar and reconstruction, you would think that you're going to tangibly improve quality of life thereafter. And so this has been something that's been studied extensively in things like breast reconstruction, for example. And I, with my interest in burn and scars and burn survivors, just had this very basic question around reconstructive scar surgery. Just very simply put, does reconstructive scar surgery universally improve the quality of life of those patients undergoing those procedures? And at that time, the best available data I had to ask those questions was through the burn model systems, which I know you guys are a partner with Neidler and all the great work that's funded by that organization. And, using the existing data that we have for burn survivors who had undergone reconstructive and scar surgery, we found that there was a decent amount of patients who did not have global improvement in quality of life after these scar operations. And anecdotally, I also had encountered patients over the years that were pretty unhappy after some of these operations, and had regret in doing them. And that, combined, those two things just didn't sit well with me. I think it's very easy to understand why we do all of the initial surgery up front after a burn. These are life-saving operations. Got to get the dead stuff off, and you got to get the wounds healed, before the bacteria and the mold take over. It's very concrete. It's very straightforward. But the nuances of, the band across the, the neck and the axilla, or how much your eyelid, your mouth is being pulled, and, how, this finger doesn't work, and that toe's curled back, and the knee, these more nuanced things that start to become more of an issue, especially as our burn survivors, rehabilitating and get back to some form of normal life. How do you approach that in a way that sets proper expectations and that gives patients sufficient information to make really educated decisions about, number one, do they want surgery to fix that? Number two, what are their expectations of how well it's going to work. And I think even bigger than that is a question of, for some burn survivors, as you know very well, Rachel, like you're going through a tumultuous amount of change in the recovery period. And sometimes it's very easy to make a contracture be the lightning rod for, general, like more general psychological issues. And it may be that contracture actually isn't the greatest barrier or the greatest challenge that a burn survivor is facing in that moment. And so, undergoing a procedure which causes a lot of pain and has its own recovery and kind of reopens the psychological wounds of the trauma from the initial burn can actually be counterproductive. And so what we did was set out to build a decision aid, which is a very simple tool that's information and also asks patients questions about themselves and their understanding of surgery, to create something that can help people make a better informed decision so that everybody undergoing scar surgery can have a positive outcome, both practically, but also psychologically.
Mm-hmm. Yeah, and I know kind of as you were explaining that, you talk about quality of life. So what exactly does that mean in terms of like context to scar surgery, like versus, I guess, even like functional outcomes versus like quality of life outcomes? How do those differ?
Oh, this is such a good question. And this is, on like a academic, professorial level, people will debate this question. So, you can create a survey or an instrument that can ask you very specific questions related to a scar. So we have all these different scar scoring instruments, and, they're going to focus on, how does your skin appear? Is it raised? How's the color different? How much does it itch? How much does it interfere with range of motion? How tall is it? There's all these very specific questions that kind of objectify the skin. That's different than a set of questions such as the one endorsed by the National Institutes of Health, which is called the PROMIS 29. It's a much longer survey of questions that gets at more globally, questions about your energy and your mood, and are you doing things in your life that you enjoy, and everything from like, how does food taste, to how are you sleeping, to how are you maintaining, and do you have productive relationships in your life? So those much more global questions. And I think that you could end up in a scenario, and we've had patients like this over the years, where you have a scar and you have surgery on that scar and you objectively improve that scar, but the patient's overall quality of life may not improve, because it may be that scar, though it is something that is causing, a physical limitation, is not actually globally affecting the patient's overall quality of life. So for example, say somebody's biggest issue is, confidence and being in public and, meeting new people and relationships, right? Well, you could have surgery on a scar on your hand, and it may get better, but you may still be pretty unhappy with not solving that other issue, which is something that would probably be solved with, something that you guys offer at the Phoenix Society, like all the counseling around being in public and about eye contact and all that great stuff that you guys teach. And so I think that's part of what this is getting at, is that, as I mentioned, I think scars can kind of be a focus for burn survivors on something to fix, because it's like, oh, look, there's something that can be fixed. Let's fix it. But really, it might be that some of the biggest challenges are actually not the scars, right? It's like, it's the more global recovery, psychology, interpersonal teachings that really should be addressed prior to undergoing scar surgery.
Mm-hmm. Yeah. So is that kind of like the biggest misconception you think survivors have about scar surgery? Or I guess like that thought or that idea that, by fixing this scar, maybe the example you used was so great. Like if, I have a hand scar and I get a surgery to try to make it smoother or whatnot, like that would help my confidence being in public, even though that's like, I guess, is that kind of like that misconception of like, oh, if I fix maybe how my scars look or make them look a little bit better, then, you know, these other maybe like social and emotional aspects to healing will also be resolved.
Yeah, that's exactly right. That's a very nice way to say it. So, for example, in this project, we used qualitative research methods to interview burn survivors, family members, also people who practice within burn care, from surgeons to therapists to psychologists, to kind of tease out these different nuances and relationships, like what you're talking about. And what we encountered was, thankfully, about 58% of burn survivors who underwent scar reconstructive procedures overall felt that the surgery met their expectations. And we actually had a quarter of patients who thought that their expectations were even exceeded, which is fantastic. But we also found is we had about a quarter of patients who really felt that things fell short. And when we teased out what the themes were there, it allowed us to actually create a set of questions that we think all burn survivors should be asked prior to undergoing scar surgery. Because if you answer a sufficient number of these questions in a certain direction, it really should give pause that the surgery could actually lead to a setback in recovery in a lot of ways. And it's not that surgery should be a no, it's just that maybe now's not the right time. And I'm happy to go through any of those themes that we brought out. We're also super excited. We're presenting this work at the American Burn Association this year. I'm actually having one of our burn survivors who worked on the project. Actually, she'll be presenting some of the work herself. So I'm super excited for her to do that.
That's very exciting.
But, you know, for example, you know, there's this general theme of, you know, what do you identify within these statements? So you say, statement would be, I have seen reconstructive surgery completely remove scars, and I hope my surgeon will make me look as if I were never burned, right? Versus, I know my scars will never completely be gone, but I'm willing to undergo surgery to make them better. And so on that spectrum, you rate, like, which one is your mind at? Are you on the side where you're hoping that your surgeon will essentially remove all your scars and it'll look like you were never burned? Or are you on the side that, you know, your scars are part of your identity? This is not something reversible, but we're going to do our best to make them better. You know, so that question alone kind of sets the tone of expectations and where someone's head is at. You know, another big theme that came out of this work was burn survivors who went into scar surgery with an expectation of gaining physical function without having big expectations around the cosmetic appearance did much better and were much more satisfied and had greater gains in quality of life than burn survivors who really were looking to see significant cosmetic improvements. Now, we have a famous saying in plastic surgery, which is form and function are one and the same, or form follows function. So it is true that when something, looks more anatomic, looks more, quote, normal, that it's better function. That's not always the case, though. And there are various operations where you release a contracture, and what you have to put in where the area where you released is maybe another skin graft, maybe some type of flap. And it may not look, quote, normal, but it is much more functional. And so I think getting burn survivors to focus on functional recovery, functional changes in scar surgery is super important. So back to that example of someone who's having, issues with confidence, being out in public, and thinks the operation on their hand might help that. A better way to view that is like, look, if your thumb is stuck in your palm and you can't get your thumb out to put your hand on a golf club, and golfing is like your biggest, and this is like a real story for me with a patient, and golfing ends up being like one of the most fun things that you enjoy doing. And golfing ends up being actually like how you see yourself getting out in public again, getting on the course. It's like, okay, look, I can offer you an operation on your hand that will reliably get your thumb out and get you better function of your hand and get you on the golf course. There's no guarantees of what that's going to do for your self-confidence and your ability to be in public. But if getting out on the golf course is a bridge to that, great. But I think that's the framing, and that's the expectation setting that needs to happen up front. because without that, I think people could be pretty disappointed.
Yeah. Yeah. And I mean, I think I shared this on our podcast for our listeners before, but the last surgery I had was a laser surgery. And that was like, I think the second, I don't want maybe third, surgery in the series or whatever I was going through at the time. And I was very like disappointed, but kind of for the reason of like, I don't actually know why I was disappointed, because the surgery itself was successful, but I didn't have, that like the correct, I guess, like mindset going into it. And I then was like, you know what, I decided then that like I didn't need it anymore. Cause at that point it was more like cosmetic at that point for me. And I was happy with how my scars looked, and it wasn't worth going through another laser surgery to try to make it, what in my opinion was like a little bit better, wasn't worth like the pain and time of the surgery itself.
Yeah. I mean, well, thank you for sharing that story. I mean, obviously it's very personal, and I can totally understand and, relate to that story with my own patients. I think what the beauty of this decision aid is that it is, or in the near future, the full version of it will be available on the Phoenix Society website. And so our burn survivors will have the ability to kind of click through this at their own pace, to do the reading, to answer the questions, to receive, their score that predicts their readiness for surgery, and that they can kind of just sleep on that, or they can bring that to their provider, their surgeon, and say like, hey, look, like, what do you think about this? And I think it can, allow for, maybe a more productive conversation. I mean, as you know, as someone who's been in the doctor's office, and as I know, as somebody who's, the doctor in the office, we don't always have enough time together to have like a lot of the times, like this conversation with each patient really needs to be like a solid hour, if not more. Right. But like our clinics, our 4-hour clinics, we have like, sometimes 15, 20 patients. Like, do the math. Like there's like there's no time for an hour. And like, unfortunately, that's just the way medicine works today, is that there's just not enough money in the system to reimburse people to spend that time with patients, which is super unfortunate. Well, that's where this can help, because patients can kind of spend that time at their own pace and read about this and get that education beforehand, so that they're primed, so that when they get into the doctor's office, they're much more informed. They, have some idea of what direction they want to go, and then they can have a very personal conversation with their surgeon about, what's right between them. I'll say another big theme that came up in this work is, and this was one of the most enlightening things that I learned. The first couple things I mentioned to you were not terribly surprising for me. This whole idea of like function over cosmesis, this idea of like, if you're hoping for a miracle, you probably shouldn't have scar surgery. But something that was very interesting for me to learn is the number of burn survivors who said undergoing scar surgery was a temporary reliving of the trauma of the initial hospitalization for the burn. And in particular, I've had one patient who didn't have a big surgery, but my goodness, did she have a ton of pain. It was kind of like out of nowhere, and otherwise what was a surgery that should be outpatient, go home, really needed to spend a couple days in the hospital just to help with getting to the bathroom and requiring some stronger pain medicine. That theme came up a lot, that undergoing a surgery, which in the eyes of the surgeon is like, hey, like this is like nothing. Like you've been through, 25, 30 operations. You've had, skin harvested from all over your body. Like you've had major surgery. This little Z-plasty is like nothing compared to what you've been through. Yet, if that's the first time undergoing anesthesia and you're like 9, 12 months out, man, you can all of a sudden relive it all. Just like wheeling back into the operating room, waking up and having bandages on you. You may have to be in a splint. You may feel like you have a loss in your independence. And that is something that I didn't really appreciate until doing this work. And so now I'm like, I counsel people. I'm like, look, I think the surgery is not big compared to what you've been through, but I want to prepare you. There's a possibility that you may relive some of the trauma of the initial hospitalization. And we got to be ready that you could have a lot of pain after this. So this isn't the kind of thing where you should be hoping to go to work tomorrow. Like, give yourself some space. Make sure you are in a place where you have people to help you. Not, not your cousin who can be in town for one day. You might need somebody who can be there for you for weeks, actually. So that is something that was very helpful for me to learn from this, and that I've counseled my own patients on.
Yeah, that's such a good point. And, it's kind of thinking back, like, I am a child burn survivor, so I don't really remember much of my initial hospital stay, but so I think I'm a little bit different there, but it's like anytime I go to a hospital, like earlier this month, we were at, the staff went to Orlando Health for staff and board retreat, and we toured the burn center there. And I hadn't been in a burn center in a very, very long time. Yeah. And it is just like, we were in the tub room and I was like, I don't want to be in here.
The tub room does it. I knew you were going to say that. No, I really did. Yeah.
Yeah, no, it's a common thing. And plus I will say it was very warm in there and I had a big sweater on. And I was like, I guess if I'm going to overheat, this is the group to do it with. But I was like, I need to get back in the hallway. But yeah, it is just like, and then especially when you are going for a surgery and then you do obviously have that like physical component to it, but even just like the emotional and like mental like preparation, aside from whatever outcome you wanted from the surgery, just the fact that you're going back to the hospital for another procedure can be a big hurdle to overcome.
Yeah, I'm really glad you brought that up, because you kind of like are allowing me to kind of dovetail into another big theme that came up in this project, which was, and this was something voiced by burn survivors who were part of the interviews, along with psychologists who we interviewed. And that's that for burn survivors who are really, for lack of a better term, unstable psychologically in their recovery process. And by unstable, I mean like your mood is just wildly fluctuating day to day. You're still having episodes of just feeling intense anger and like you're having huge emotional swings. Not like having feelings of hurting yourself, but definitely like in a place where you're very anxious and potentially meeting criteria for having post-traumatic stress disorder. Those people, patients said that that is not a good time to undergo scar surgery, because if you're kind of teetering on the edge of just like making it through the day, going through an operation could be enough to push you past your breaking point and make you really feel like you just kind of want to give up. And so, that's another thing that we've kind of worked through, that people should be in a good place psychologically. I mean, nothing's perfect, right? And surviving a big burn, like there's always going to be some element of ongoing trauma that you're working through, but it should be in a place where it's stable. And that like you have coping mechanisms, you're in therapy, you're doing whatever it is to get you your zen, so that you can succeed in surgery.
That's such a good point. And one thing I really value about the decision aid too is just, when I was going through it and practicing with it, I liked that. I don't know exactly how to say this, but like, even if maybe it wasn't like the outcome, it reminded me of like what the outcome of the surgery is supposed to be. And that kind of goes back to some of the things we were talking about earlier. But like, yeah, if I like maybe am struggling in my emotional healing, like probably not the best time to schedule another scar surgery, or, just that reminder too of like, this surgery isn't going to fix like the underlying issues that are underlying problems that maybe you're struggling with. So I've really valued like just that gentle reminder that you kind of got as you were going through it.
Yeah, that's very well said. I mean, I certainly don't want people to misperceive the point of this project and this decision aid. Like my point is not to talk you out of surgery. Like I like, this is what I do for a living. I mean, Though I would be totally happy if we cured burns and no one gets burned again and I have to go find a new job. Like that would totally be fine with me too. But I'm not here to say that like surgery is bad or surgery is evil.
Yeah.
I'm just here to say that there's a lot more to the decision than simply like, oh, wow, look, there's a band. It could be fixed, or there's a big contracture. We could put a flap there. Or it's much more complicated than that.
Mm-hmm.
And I also don't mean to be offensive when I say that plastic surgeons that devote their careers to burn may understand this better than plastic surgeons who don't. But I also would just say that, in talking to a surgeon and a provider who, may be the world's greatest plastic surgeon in terms of what they can achieve with the tissue, if they're not somebody that's as familiar with all these other issues that go into burn survivorship, I think it's really great to supplement your consultation with that surgeon with this decision aid, because it allows you to read through something that was designed by burn survivors for burn survivors, with the input of surgeons and psychologists and therapists. And it just allows you to make a better decision. And it may not be that the answer is like, no surgery ever. It just may be like, hey, maybe surgery right now is not the best choice. And maybe actually there's an alternative that could actually make you happier.
Mm-hmm. Or I also see the aid being a good tool to go, schedule the surgery, but have the correct mindset of like, what am I achieving with the surgery? Because I get what you're saying, but and like you said, I think it's a really good tool for survivors. I'm the type of person that, I need to write a list of things I want to cover with my doctor or my therapist, because then I will go in there and be like, oh, I completely forgot everything that I wanted to cover with you today is completely went out of my head. So I think that's just a huge benefit too. Even if you take it and it says and helps you reaffirm that you are ready for surgery, it's still a great, talking point and guide with your doctor.
Well, I love that. You're my favorite kind of patient, because I call that like, you did your homework, right? Like you came to your clinic consultation, you have a list of questions, you've thought through things. That makes the clinic visit so much more high yield. And just as the surgeon, makes me so much more comfortable and confident in operating the procedure. It's also totally fine for people who leave the clinic consultation after a scar discussion. Sometimes people leave with more questions than they came in with. And I think that that's also fine too. And that's why in some situations, it's better to have multiple visits with your doctor prior to embarking on this. But hopefully with this tool, people can just feel more prepared. And, on that same note, I think that this is like version 1.0, right? It's very possible that, whether it's you, Rachel, or someone from the Phoenix Society is like, hey, like, this decision aid is good, but like, you know what? Like this, like the part about like the prehabilitation, like we always talk about rehabilitation, which is like, what happens after an injury, after an accident, but like prehabilitation is this concept in surgery of like all the kind of training and work you do before undergoing an operation. It's possible that we want to, put together some type of package of prehabilitation prior to scar surgery, particularly for our burn survivors with larger surface area injuries. That includes, something that's going to be informed by you all. And whether that's like, working on your sleep prior, your exercise, your nutrition, whether that's, meditation or acupuncture or whatever it is, something that's going to set you up for success.
Definitely. Well, and, whether you use the aid or not in this discussion, I think it's just as important to have these conversations with your doctors as with other burn survivors or caregivers. And, whether that's through Phoenix Society, we have our Facebook group, we have support group, all of that can help. But I also think hearing it from, especially as a survivor, and I don't think Amber will mind I'm sharing this story, but, part of the reason when she was done having surgeries and made that decision, that was partially because like I told her about how I made that decision. And she was like, felt, I think, like comfort knowing that like, oh, someone else decided that, like, I guess like sometimes this may sound dumb, but like you kind of get in the mindset of like, for me, it was like I was going for a new surgery every summer vacation. That was my summer break from school, was back at the hospital. And then it got to a point where it was like, I am happy with how my scars function and how they look. Like, I don't need to just keep repeating the same behavior like I said, with something that maybe I wasn't, yes, maybe like functionally the surgery went well, but to, your point, like I didn't see or feel the outcomes that I thought I was supposed to. So I think, again, not trying to preach like stop with the surgeries, but I do think like if you are having a conversation with your doctor and you just want to talk to another survivor who had something similar or whatever, it's nice to talk about, what the recovery is like, how they felt with it afterwards. Were they happy with the outcomes? Not that it's an end all be all, but that person is important.
Yeah, that makes so much sense. And I think that's where, your team at the Phoenix Society and the network through SOAR and all the peer supporters play such an important role in being able to crowdsource opinions and stories about this. I mean, you brought up laser a couple of times. I'll have patients come to me and they'll be like, so how many lasers am I going to need? And I'm like, well, it's different for everybody, but you will know when you no longer need it, because, I almost guarantee everyone that they're going to have improvement in their itching, because I've never had someone not have improvement in their itching. Not to say that it goes away, but like that is like the biggest benefit. And I'm always like, the aesthetic changes, maybe the skin will give you a little bit more motion. It's marginal, it's something, but it's not big. But yeah, you'll have people that are like, it's a very low risk procedure, right? Like it's you may have a little wound here or there, your skin may be a little sensitive, but in general, very low risk compared to like, big incisions. But yeah, people will be like, hey, after my last one, like, I don't really, like, nothing really changed, it was amazing after my first one or two. And it's like, yeah, that is your mind, your body telling you that like there's a law of diminishing return for this type of procedure, and you've reached it. So that's great. Like that is also something to celebrate. It's not that, oh, there's nothing left for me, there's no more options. It's that like, no, actually you've graduated to a point where you're happy and you don't need it. Like that's like once again, like I'm happy to put myself out of business. So I like that. That's great.
Yeah, no, I love that. Well, obviously a lot of this decision aid went around your research, and I know you kind of have, you're, like I mentioned in your bio, you are involved in research, of course. So maybe even just with scar surgery, or what kind of, I guess, just gaps or holes you want to fill with some of the work you're doing, whether it's with the decision aid and scar reconstruction or kind of anything with burn survivor healing.
Yeah. So very, very specific to this decision aid, our next steps, which I'm hoping to get around to finishing a grant I'm writing for this year, would be to use this decision aid in like a randomized controlled setting. So, allow some burn survivors to use it, others to not. Of course, that becomes a problem if people find it on the Phoenix Society website anyway. But and really try to demonstrate its efficacy. So, we've piloted it and it's worked for our patients, but that's just a pilot. I want to be able to show, the most scientific way to show that it works is to show that in patients who use it, they have better outcomes than patients who don't use it. I still, no matter what, it's a low harm thing. I still think it's helpful, but it would be nice to actually quantify how helpful it is at having patients not regret their procedures and having them have gains in their quality of life after. I think in terms of research questions that we still have unanswered, specific in the kind of reconstructive surgery space, we still don't have a very good answer on how early we can start laser. We know that 6 months after being healed is safe. I, like many other surgeons, are willing to kind of shorten that down to 3 months. Can we go shorter than that? I think there's also questions about what type of laser. Kind of the backbone is going to be a fractional ablative laser, like a CO2 type laser that pokes those little dots, those little holes all the way through your scars. There's other lasers that use, more vascular wavelengths to get rid of the redness in early scars. So intense pulse light and pulse dye lasers. We still don't know kind of the magic combination, a way to kind of more objectively look at the scars and pick which ones at what timing, how many, we've gotten into that question of how many, do you combine with injecting different types of agents that stop cells, fibroblasts from causing a scar. So injecting with steroids, injecting with 5-fluorouracil. These are all things that we kind of do. We as surgeons, we do it when it feels right. We kind of have our own gestalt that we follow when we make these decisions, but we really don't have good science to say like, hey, this is the right way to do this. Something that I think I'm very excited about is there is some laboratory evidence out of Stanford. I mean, as you said, I'm not a basic scientist. I'm not like pipetting and doing experiments on mice. I'm more doing, studies with people, and I do population health and epidemiologic type studies. But I am very excited about some of the research in the labs at Stanford, which have been able to show that a molecule named verteporphyrin can allow for near scarless healing in animals. And, people are doing the work trying that on humans. That is really cool. If we could have something that we could inject or place during either at the end of a burn treatment, during reconstructive scar surgery, that essentially is going to allow, less scar with the surgery. I mean, that is, that could be a game changer and really drive a lot of positive change. So I think that's something to kind of look out for. Probably more of like a 5 to 10 year horizon. I think that's really exciting. I also, just back to this idea of like, you need to heal psychologically before you tackle going after scars. I think that's something that needs to be studied a little bit more, be standardized a little bit more, have a little more information of measuring someone's psychological ability to succeed with these types of operations. So these are all things that excite me in that area.
No, that sounds amazing. I always love hearing about like the newest technologies or like the newest research that's happening. I think that's, obviously we are, partners with ABA, and I get a little bit of that way, but, when they send out something in the burn journal, it's mostly all over my head and I don't understand the little details that's going on. But that's kind of one of the other questions I wanted to ask you of like, you're talking about this new technology, you're working on the decision aid. I know, lots of burn centers and burn surgeons are also working on things like how can survivors stay connected and, get the latest on these technologies or, learn what new tools like the decision aid, obviously, Phoenix Society is promoting that, but how else can survivors kind of stay in touch with some of this?
Yeah, that's a great question. Well, I kind of see this as bidirectional, and I see it as an ever growing reason why the Phoenix Society and the American Burn Association should have a close relationship. What is the point of giving talks and showing the science for technology and tools and devices to help burn survivors at the ABA meeting if there's no burn survivors there? Like, how do you, like this gets up the question of like, how do you disseminate knowledge? How do you get it into practice? Well, you would hope that your plastic surgeon is at the meeting, learning these things, adopting these things. But the diffusion of information and knowledge can be actually quite slow and sometimes lag 5-10 years behind the cutting edge. So I think this is a great question, and where there has to be great partnership between the two societies. The Phoenix Society at its every other year World Burn meeting should really look to the ABA and invite hey ABA, what are the greatest things that we are ready to translate and that the burn survivor community should know about today, and then have those presentations at World Burn, where so many of our burn survivors go or at least go at some frequency. The ABA meeting itself burn survivors are always welcome to attend, and we do get decent attendance. They're always welcome to be there and go to the talks, and if the interest is in reconstructive, there's the reconstructive forum, the best abstracts, the 2-hour session. Reading, I think you guys have done such a great job, with your periodical and your website of giving that information out there. In terms of reading the journal, yes, it's not just you. So if I'm going to read a paper that's going to go into animal studies and basic science, something that I don't do a lot of, I got to take my time in reading that, and vice versa. If someone who does basic science wants to kind of read some of my epidemiologic work, I'm happy to break it down. This is an area where I would actually give a plug for AI platforms, whichever your favorite one is. But if you copy and paste an article into ChatGPT or whatever AI du jour engine, and you're like, hey, please summarize this article for me in simple language, and hit enter, you will be shocked. You will get something that is really good. Like you obviously can't vet it because you're just assuming it's doing a good job. But I would highly recommend considering that. If you find the title of something, or something seems interesting but you can't understand it, just copy and paste it in there and ask it to give you a simplified summary. So I think that's something you can do. Keep your ears open, talk to your, ideally I'm going to make a plug for verified ABA centers. Go to, make sure you're, visit with an ABA center, talk to their support groups. Our center has a great support group that tries to deliver the most current technology and science. Be part of that community. If the diffusion of information can take 5 to 10 years, you can be at the front end of that. If you're connected, if your ears are open, if you're at World Burn, maybe check out the ABA.
No, definitely. I am excited. I will be at ABA's annual meeting again this year. I'm actually presenting a poster for the first time. Yeah.
Cool. I'll come check it out.
You can check it out later. I can give you a rundown. I'm a little nervous, but very excited. So
no, that's great. I mean, really what the meetings come down to is, yes, it's about the science, but the social aspect is also such a huge part of it. It's being together, and it's the conversations that come from the posters, right? It's less about the poster itself. And so anyway, I'm so excited you're there. I assume you'll be at the Phoenix Society booth too, potentially.
Yes, no, because that's normally where I always go, and I'm always at the booth. But I was shocked. My first ABA meeting, I guess the first one back after COVID. I was supposed to go in 2020, and then it got pushed. But I will say, it was I shouldn't say I didn't think I would fit in, but I was pleasantly surprised how much I could actually digest and take away. Not just obviously as a burn survivor myself, but before the work that I do at Phoenix Society. So obviously the posters, there's so much great work going on. And I don't know if, especially survivors like me who are further out, if I wasn't as connected to Phoenix Society and ABA, I wouldn't see all of that. But it is truly inspiring, like I said, how much work you're doing. And there's just so many dedicated burn care professionals out there who are just very, very inspiring with the work that they do.
Cool. Well, I'm so excited to hear that you're branching out from the booth to the poster. And
baby steps.
There you'll be on, next step is the podium. No, but that's great. I really love the partnership between the two organizations. We need more of it. So thanks for engaging in that.
Yeah. Well, I know that we are coming up on our time, and I do have 2 final questions that we always ask our guests. But before I ask you those, is there anything else you want to share about the decision aid, or anything in general that you want our listeners to know?
I mean, in essence, I'm just very happy, satisfied to work on a project that was inspired by burn survivors, by descriptive research that we did and published, and then, build something that hopefully can help a lot of people and be open for iteration. And yeah, just to let burn survivors know that there's a lot of us thinking about how we can make your lives better in, many ways, shapes, and forms, including surgery, but also including the power of information. So, very, very grateful to the partnership with the Phoenix Society on this, and for the Plastic Surgery Foundation for funding this work.
Yes, no, definitely. We're so thankful to, partner with you and have this great resource. And as you mentioned earlier, it will be, right now, we have the great article, which we will have linked below, but as it becomes more fully functioning and, interactive, it'll be such an amazing tool for survivors to have.
Thank you.
Yeah. So with that said, like I said, we do ask our guests 2 final questions. The first one is, what is the most common question you get in clinic, and what is your answer to that question?
So the most common question across all my patients, I have something that immediately jumped to mind. Just giving the context, this is a range from people who have, very simple, second-degree scald burns, to people who have really, really severe, deep flame burns. Is the most common question is this going to scar? Is there going to be a scar? Is there going to be a permanent change in my skin? That is the most common. Or they'll say, is that, how long until it goes away? And depending upon how much anxiety I feel is behind that, or how much fear, or just pure curiosity, kind of depends on my answer. So in the people who are very curious, I will turn that conversation into a little bit of a nerd talk on fibroblasts and skin healing and melanocytes and pigment, and really go into what drives the changes that we see in skin as it heals and matures into something that we would call scar. I mean, something I learned at the recent World Burn Congress this last fall in Kentucky was burn survivors who said, I prefer to refer to that which you see as my skin. I don't like to refer to it as scar, because it's my skin. And that was like mind blowing for me. I was like, wow, how often do I say scar in clinic when really I should be saying skin? Because it is your skin. It is, yes, it is scarred, but it is your skin. So in answering that question with the patient, my goal is to set a very realistic expectation, and giving somebody this idea that maybe down the line the color will be normal, with 5 lasers and all this surgery and all these steroids. We can get it normal. No, I'll never say that. And anyone who says that, you're really setting somebody up to be pursuing something that's not achievable. My answer is always, there's only so much control I have over what your body is going to do. A lot of this is determined by your genetics, your ethnicity, your biology, your environment. And our goal is to make your skin as functional and as symptom-free as possible for you. And I mean, and that's the honest truth, right? I can't promise anything. I can't promise anything more than that. I mean, I've had people form huge keloids from very simple scald burns. And I've had people who have skin grafts on muscle, the deepest burns, and 2 years later you can pinch their skin and it pulls up into your hand and there's no contracture. You're like, what the heck? I didn't do anything different here. The difference in biology of people and how we heal and how we, how our skin changes is profound. And not to get too philosophical here, but that also leads me to one of my favorite pieces of philosophy I give my patients and myself and all of my nurses, which is the Serenity Prayer. I don't know if you're familiar with the Serenity Prayer, but the Serenity Prayer, says, God grant me the ability to have the courage to change the things that I can't, to have the ability to let go of the things that I can't change, and to have the wisdom to know the difference between those two. And that you can apply that to life in general. And, the word God makes you uncomfortable, like you can substitute it with whatever power that be, I wouldn't get hung up on that. But I think that that's a big piece of the SCAR process, which is there are things we can control. There are things we can't. Let's focus on the things we can control. Let's let go of the parts that we can't. And with that mindset, we're always going to win.
Mm-hmm. That's so powerful. Thanks for sharing all of that. That might actually be part of your answer to my final question, which is our Phoenix Partner question today, sponsored by Alistair. So their question is, what is one message you hope sticks with our listeners today?
I think the biggest message on this general topic is around expectations. It's around. I feel like there is so much. You have so much more power over your outcome, over your happiness, over your quality of life when you have more information. And this is beyond skin and scars and burns. I mean, this is for everything. You are just so much better able to make decisions and to have more reliable outcomes when you are better informed, particularly around expectations. If something ever seems too good to be true, it probably is. And I recommend just being a good consumer of information prior to embarking on any big decisions, especially undergoing the scalpel.
Definitely. Well, Dr. Sheckter, it has been such a pleasure working with you. Thank you so much for coming on the podcast today. Thank you so much for taking the time to write that article for Journey Magazine last year. And like I said, we will have that linked below. But yeah, and I think on behalf of all of our listeners, thank you so much for the work you do for the burn survivor community.
Yeah. Well, thank you for having me, Rachel. Thank you for hosting this podcast. And I hope this is just one step in the greater conversation, and that we can keep the work going.
Certainly. Well, thank you again. And I will see you in April at ABA.
Just like, all right. See you in April.
Yep. Thank you. Bye.
Bye.
Thanks so much for tuning in to this episode of Girls with Grafts. If you are enjoying this content, please feel free to rate, subscribe, and leave a review wherever you listen to your podcasts. This helps others find the show, and we greatly appreciate it. Thanks again for listening, and we'll catch you in the next episode.